I'm Whitney Morgan, Hashimoto's coach, gluten-free warrior, and creator of the Thyroid Reboot Method. Now, hopefully, you're already in the habit of getting an annual checkup with your doctor every year. And part of your checkup probably includes some basic blood work. One test that doctors usually run is called a complete blood count, or CBC. A second test that they might order is a comprehensive metabolic panel, or a CMP. These two tests are the gold standard for your basic health assessment. But if you have Hashimoto's or hypothyroidism or any chronic disease, really, I recommend that you ask your doctor to expand this basic blood work to include 6 additional markers. In today's video, I'm going to focus on my first 3 recommendations. So this is part 1 of this series. And if you want to hear about the remaining 3 recommendations I have for you, make sure you tune in for part 2. But before we jump into it, go ahead and hit that subscribe button and the little bell next to it so you'll get notified every time I post a new video. First, let me just say that today's topic does not include thyroid hormone testing. For my suggestions regarding how often to check your thyroid and what thyroid markers should be included in any thyroid lab testing, please watch a previous video that I recorded on that topic. What I want to focus on today are those markers that I think are important to track in women with Hashimoto's and hypothyroidism, but aren't usually included in your basic annual blood work. The first marker to ask for is vitamin D. Maintaining a robust vitamin D level is essential in the fight against Hashimoto's and any other autoimmune disease, actually. In fact, current research suggests that women with Hashimoto's tend to be chronically low in vitamin D, which makes it more likely that they will get autoimmune flares. Most functional doctors agree that optimum vitamin D levels are somewhere between 50 and 100. Personally, I like my clients to be in that sweet spot between 60 and 80. Now, we can't always rely on sun exposure to maintain our vitamin D levels. And in fact, most women with Hashimoto's do end up being on some amount of vitamin D supplementation long term. The second thing to ask your doctor for is a complete lipid panel. And this is also known as a cholesterol panel, right? You're going to get your total cholesterol, your HDL, your LDL, your triglycerides. And the reason why we want to keep tabs on a lipid profile is because there's a strong correlation between both Hashimoto's and hypothyroidism and elevated triglycerides, or also elevated LDL, which is considered the more problematic form of cholesterol. Regardless of how healthy your diet is, having low thyroid function predisposes you to higher levels of triglycerides and LDL, which will increase your cardiovascular risk. The third marker I want you to ask your doctor for is called C-reactive protein, or CRP. C-reactive protein is made by the liver, and it increases when there's inflammation in the body, either due to acute reasons or chronic conditions. Currently, it's the gold standard we use to monitor systemic inflammation in the body. Personally, I think it's important for anyone with a thyroid issue to monitor their inflammation levels, but particularly when you've been diagnosed with Hashimoto's, because Hashimoto's is an autoimmune disease, and the hallmark of autoimmune disease is systemic inflammation. Now, I can't think of any reason why your doctor wouldn't agree to add these things to your basic blood work. Vitamin D levels, C-reactive protein, and a lipid panel, these are all very normal things to track. But when you have Hashimoto's or hypothyroidism or any autoimmune disease, keeping track of these 3 things is just the proactive thing to do. Now, speaking as a health coach, I can tell you that having this information on my clients, at least on an annual basis, is super valuable for tracking progress as we work to reverse their hypothyroidism or their Hashimoto's. If you want to learn more about me or my thyroid reboot method, go ahead and click on the link that I'll drop in the video notes. And if you found this video helpful, let me know. Like it, subscribe to my channel, or share it with someone who's got Hashimoto's or hypothyroidism. And don't forget to tune in for my next video, which is part 2, where I'll talk about the 3 additional markers that I recommend you ask your doctor to add to your annual blood work. All right, everybody, thanks for watching. I'll see you next time.